Welcome to this webinar on respiratory viruses and the workplace. This webinar provides employers, supervisors, and workers with information about minimizing risk from respiratory viruses in the workplace. Before we begin, we have a disclaimer and copyright notice that we need to bring to your attention. We've done our best to ensure that the information in this webinar is accurate and up to date. However, if there's any discrepancy between this webinar and Occupational Health and Safety, or OHS, legislation, the legislation is correct. Please take a few moments to read the disclaimer notice. This webinar presents information from the Respiratory Viruses in the Workplace Bulletin on the OHS Resource Portal. To access the bulletin, visit the website address shown here. In this webinar, we're going to cover what respiratory viruses are and how they are spread, legal obligations for employers and training requirements for workers and supervisors, and best practices that can be implemented as ways to control respiratory viruses in the workplace. Let's begin by talking about respiratory viruses. A respiratory virus is any virus that infects the lungs and/or breathing passages. There are a large number of respiratory viruses. Many of these circulate in the population regularly and cause illnesses such as flu or the common cold. Although people can get sick from respiratory viruses at any time, they may be transmitted more at certain times. An example of this is cold and flu season, which runs from November to April in Alberta. New viruses are generally only a public health concern if they can make people very sick. For example, many new strains of the coronavirus family cause nothing more than a common cold. However, one of these new strains, SARS-CoV, led to an outbreak of severe acute respiratory syndrome in 2003. Another new coronavirus strain, SARS-CoV-2, led to the COVID-19 pandemic. Respiratory viruses can spread directly or indirectly. Direct infection can happen if someone coughs or sneezes on you, or through physical contact, such as shaking hands with someone who is sick and then touching your eyes, nose, or mouth. Indirect spread can happen from contaminated surfaces, such as tissues, cloth, or paper. Alberta's occupational health and safety laws include a number of provisions intended to protect against workplace hazards, including respiratory viruses. Let's have a look at some of these now. Employers must perform a hazard assessment to identify existing and potential hazards, including respiratory viruses, at a work site. Employers must also eliminate all identified hazards if reasonably practicable. If elimination of a hazard isn't reasonably practicable, it must be controlled. When assessing the potential exposure to respiratory viruses in the workplace, employers should consider factors such as the size and layout of the workspace, the infectiousness of potential respiratory viruses that may be present, how often workers are exposed to coworkers, clients, customers, members of the public, and contaminated surfaces, and how much workers can limit exposure to sick individuals in the course of their job. The table on this slide shows some potential examples of how to determine respiratory virus exposure levels as part of a hazard assessment. Remember, though, these are just general guidelines. Employers must do a hazard assessment to determine existing or potential exposure levels at their specific worksite and choose which controls would be appropriate. When controlling a hazard, different types of controls are applied in a specific order of legislative preference. The first choice is to use engineering controls, which control a hazard at the source. Depending on the workplace, examples of engineering controls might include ventilation systems or physical barriers such as plexiglass. If engineering controls are not reasonably practicable, administrative controls must be used. This type of control changes the way people work. Examples include worker training, hand hygiene, physical distancing, alternate work arrangements, and regular workplace cleaning policies. If the hazard cannot be controlled with either engineering or administrative controls, personal protective equipment, or PPE, must be used. Examples of PPE include gloves, eye protection, face masks, and respirators. For an employer's guide to respiratory PPE, as well as information on selecting respirators and masks, visit Alberta's OHS resource portal at ohs-pubstore.labor.alberta.ca and search for publication IDs PPE001 and PPE009. Employers may use a combination of these three types of controls if there is a greater level of worker safety because the combination is used. Effective controls for workplace hazards depend on site-specific and task-specific factors. For instance, at work sites such as hospitals, where workers have a high risk of exposure to infectious droplets and airborne hazards, They may need to wear respirators as a PPE control. In all cases, employers must evaluate the effectiveness of their control measures and review and revise hazard assessments as needed to prevent unsafe or unhealthy working conditions. The table on this slide shows some examples of different control types that might be used to control respiratory viruses. Again, these are just general guidelines. Employers must do their own hazard assessment to determine which controls would be most appropriate for their specific worksite. To learn more about hazard assessment and control, including Alberta's legal requirements and best practices, see Part 2 of the OHS Code and the Hazard Assessment and Control Handbook on the OHS Resource Portal. In addition to hazard assessment, elimination, and control, employers should consider whether first aid services are adequate to look after workers who are ill. Employers should prepare for a pandemic virus as a potential biological hazard and as part of emergency planning. Learn more in Emergency Response Planning and Occupational Health and Safety Toolkit on the OHS Resource Portal. Under OHS legislation, employers have a general duty to ensure workers and supervisors have the training they need to work in a healthy and safe manner. Examples of this applied to respiratory virus control include providing workers and supervisors with up-to-date training on respiratory viruses, respiratory and hand hygiene practices, and other procedures to protect workers from respiratory viruses. Ensuring workers and supervisors are familiar with the occupational health and safety laws that apply to respiratory virus control at the worksite. And ensuring workers and supervisors know where cleaning supplies and PPE are kept and how to access them. If potentially harmful chemicals are being used to control respiratory virus hazards, employers must also provide Workplace Hazardous Materials Information System, or WHMIS, training, as specified in Section 397, subsection 1 of the OHS Code, and training in the procedures developed under Section 21 of the OHS Code that are related to the potentially harmful chemicals. Best practices can be an important part of controlling respiratory virus hazards in the workplace. Remember, best practices evolve and improve over time. Make sure you have up-to-date advice from expert sources when deciding what practices to follow. Let's take a moment to look at some worksite best practices to prevent respiratory viruses from spreading. Employers should review and identify operational areas that may be vulnerable to absenteeism if workers are sick or need to stay home to take care of sick family members. Employers may need to address other hazards to workers that are more indirectly related to respiratory viruses in the workplace. Potential examples of such hazards include stress due to a fear of getting sick or concern about sick family members, fatigue resulting from having to work extra hours, and changes in working conditions related to increased or different workloads. To ensure business continuity, employers may want to explore options that can increase flexibility in how and where workers get their work done without in-person contact. These include work-from-home arrangements, teleconferences and virtual meetings, and using mail, fax, telephone, or email instead of in-person communication. Depending on the work site and nature of the work being carried out, minimizing crowded situations or enabling workers to physically distance from each other can help decrease the risk of respiratory viruses. Physical distancing involves making sure there is adequate space between people, even if they don't show any signs of illness. Other ways to help control viral spread include keeping hands away from the mouth, nose, and eyes. This avoids bringing respiratory viruses in contact with mucous membranes where they enter the body. When it comes to preventing the spread of respiratory viruses, washing hands with soap and water is an important part of good hygiene. If hands aren't visibly dirty, using a hand sanitizer with at least 60% alcohol can also be effective. Now let's look at some precautionary principles. Anyone who is sick should stay home from work. Employers can encourage sick workers to stay home by having a supportive sick leave policy. It could also be helpful to allow for remote work if a worker is well enough to work remotely and opts to do so. Call HealthLink by dialing 811 in Alberta if you have questions about your health. Good workplace hygiene practices can also be important in controlling the spread of respiratory viruses in the workplace. Cleaning may need to be enhanced at certain times of day. For instance, a break room may need enhanced cleaning after a coffee or lunch break. Pay particular attention to frequently touched objects and surfaces, such as elevator buttons, doorknobs, desktops, keyboards, equipment control handles, and hand tools. Clean shared workstations and equipment when individuals are changing workstations. If possible, discourage workers from sharing phones, desks, offices, or other work tools and equipment. Reassess routine business practices, such as shaking hands when making introductions or at the end of a meeting. To minimize crowding at entrances, exits, and break rooms, stagger the start and end times of work shifts and break times. Minimize the use of shared utensils, tableware, cookware, and towels in kitchens and break rooms. When seasonal and environmental conditions allow, plan for social meals and activities to be held outdoors. There are vaccinations for some respiratory illnesses such as influenza and COVID-19. Employers could consider providing on-site workplace immunization clinics to make vaccination more convenient for workers who choose to be vaccinated. More information about vaccinations for influenza and COVID-19 is available at myhealth.alberta.ca and alberta.ca/COVID-19-vaccine. During a respiratory virus outbreak, employers, supervisors, and workers should check and follow all advice provided by public health officials. For example, travel advisories may affect workers who are planning to travel for work purposes. In addition, if isolation measures have been adopted in an outbreak, employers must follow public health direction. Thank you for viewing this webinar. If you have any questions about respiratory viruses in the workplace, call the OHS Contact Center at 1-866-415-8690 or call 780-415-8690 in the Edmonton area. Please help us improve our webinars by filling out a short survey to give us your feedback.